Thank you, Chairman. Thank you for this timely hearing, or perhaps maybe untimely hearing. Couple of questions. First, Ms. Semcer, which international forums or organizations do you think are most effective and should be getting supported by the United States as a matter of our leadership on this issue? Mike?
I apologize. I believe our continued engagement in the Convention on International Trade in Endangered Species is absolutely critical to addressing this issue. I would also offer that we should begin more bilateral engagement with our partners in Africa and elsewhere where there's a high risk of zoonotic disease emergence so that we can tackle this problem not just multilaterally, but bilaterally.
Role of the World Health Organization?
As I said in my earlier testimony, I think that what we've seen happen is indicative of the need for greater U.S. leadership on this issue. We cannot count on other countries to succeed in deterring the spread of zoonotic disease through demand reduction campaigns and even outright bans on consumption. Leadership requires engagement. Whether or not the World Health Organization is the appropriate forum for such leadership and engagement is beyond my area of expertise, but the U.S. must engage with the rest of the world on this issue if we are to confront it.
Dr. Epstein, what is the next virus that you're worried about? Is there one that you've got your eye on that has not yet popped up into general circulation, but is something that concerns you?
The million-dollar question, isn't it? I mean, I will say that collectively as a group, coronaviruses remain a concern in that we know that there exists a diversity of viruses related to SARS and to SARS-CoV-2 that continue to circulate in bat populations around parts of Southeast and Eastern Asia. And there's still a risk of those emerging again. And so that's something to keep an eye on. I think influenza viruses also remain a concern. Those circulate annually and evolve continuously and still have the potential to cause a pandemic. So flu viruses are important. And, a category of virus that I specifically look at that we're paying attention to is called Nipah virus. That's a virus carried by large fruit bats across Asia. And this is a virus that spills over almost annually in Bangladesh and India, causing localized outbreaks of encephalitis, carries a very high case fatality rate of about 75% on average. And so far, it's only capable of limited human-to-human transmission, but there is the potential that strains of this virus exist in nature that are more easily transmissible among people. And so we're working very hard with local authorities and scientists to put in interventions that will limit the opportunity for that to jump. So that one is on the radar, but I'd say a little differently than things like coronaviruses and influenza viruses, which have proven to be both transmissible and have the ability to cause global pandemics.
And to both of you, which aspects of U.S. trade policy should be brought to bear on dealing with this issue?
Should I begin?
Sure.
Trade policy. So one of the issues that sparked that report I mentioned earlier from the GAO was really that we have a piecemeal approach to looking at importation of zoonotic disease through wildlife trade and live animal imports. The CDC has jurisdiction over known zoonotic agents and the animals that carry them. And so there's some regulatory authority there to regulate, say, the importation of bats for the virus that I just mentioned, Nipah, or rodents because of the monkeypox outbreak that was sparked by the importation of African rodents that led to infection of prairie dogs that were sold as pets, and then infection of people in the Midwest back in 2004. But it's very specific to already established threats. USDA regulates the importation of animals looking at diseases that threaten livestock health, but doesn't look specifically at wildlife. And so from a regulatory standpoint, we still have a big gap in looking across the board at live animal imports and the potential to carry zoonotic viruses. And that is something that needs to be addressed. And I wanted to say one more thing before I hand over to my colleagues. And CITES has been mentioned a few times as an effective framework for dealing with this issue, but there are a couple of shortfalls, and I agree with Mr. Ashe that CITES would have to be amended. Number one, CITES doesn't address health issues in animals. Number two, it doesn't cover all the species that are known to be reservoirs for zoonotic viruses, some of which aren't protected or aren't endangered. And three, it doesn't govern the intra-national movement of animals, which can still present a risk for emergence in a market system. And so these are things that would need to be addressed to make sure that this kind of global convention or treaty would be effective at protecting health.
Thank you. My time has expired.